Hello, welcome everyone. We will get started in about 5 minutes at 1 p.m. Eastern Time. Thank you. All right, everyone, welcome. We're at the top of the hour. Thank you so much for joining us today for our second installment of LBDA's 2024 webinar series. I'm Julia Wood, the Director of Professional and Community Education here at the Lewy Body Dementia Association. This year, we will empower you with education to help you understand and cope with the symptoms of Lewy body dementia, adopt wellness strategies like today to promote quality of life, and understand the latest relevant scientific advances. Before we get started, I'd like to give you a few words about LBDA. We are a national nonprofit whose mission is to optimize the quality of life for those affected by LBD by accelerating awareness, advancing research for early diagnosis and improved care, and by providing comprehensive education, like today, and compassionate support. A few housekeeping items before we get started. You are welcome to submit your questions anytime using the Q&A button at the bottom of your screen. Following the presentation, I will moderate submitted questions to our panel for about 15 minutes. This presentation is being recorded and an email will be sent to those who registered with a link to view the recording in about 1 week. To watch recording of any of our webinars in the past that you missed, you can visit our YouTube channel, LBDA TV. Also, when you leave the webinar today, a brief survey will appear asking your feedback about today's presentation. Please take a moment to complete the survey to help inform our future content. All right, so now let's learn a little bit about our presenters, and then we're going to try to learn a little bit more about who's with us today. All right, so go ahead and advance slides. So your presenters and panelists today are two of my amazing colleagues from LSVT Global, Jenny Tuccitto and Heather Hodges. And my name is Julia Wood. I'm also certification and training faculty for LSVT Global and for LBDA. So I've got that little cross feature today. All right, so we'll look at the bios and keep in mind, I'm not going to read the entire bio, but the important things for today to know are that Jenny Tuccitto is a physical therapist, and she's been certified in LSVT BIG since 2009. She doesn't look old enough to have been, and she's also part of our BIG training and certification faculty. She has extensive experience treating a wide variety of clients with neurological diagnoses over the last 20 years. Now she serves as the Director of Innovation and Communications for LSVT Global, as well as the LSVT BIG clinical expert. Our speech language pathologist today, who will be taking you through some of the LSVT LOUD exercises, is Ms. Heather Hodges, and she received her master's degree in speech language and hearing from the University of Colorado. She was a part of Dr. Lori Ramig's research team, who did a lot of the original research that we'll talk about today in LSVT LOUD. She's a consultant, expert clinician, and training and certification faculty for LSVT Global. All right, and then last is my biography, which I'll just briefly go over. So I'm an occupational therapist, and I'm just mostly going to be doing the Q&A today, but I specialize in treatment and assessment of people with Parkinson's disease and related dementias. I have been with LSVT Global since 2018 as certification and training faculty, and I've been here at LBDA since 2021. All right, so our disclosures, it's important to know that all of the LSVT faculty have both financial and non-financial relationships with LSVT Global. LSVT faculty relationships, non-financial, include that we really have a preference for this treatment technique. And I think that will probably come through in our presentation today. And then also Heather and I are consultants for LSVT Global. Okay, so now, some things to know, your microphones are muted, right? You can ask questions at any time using the Q&A button. We will be sending a handout of the presentation following in that email that you get in about 1 week. The survey will launch at the end of today's presentation for you to complete. And if you want to receive continuing education units, you can email. We'll be putting that link in the chat in a little bit. You can reach out to us and we can send you a certificate of attendance so that you can self-report for CEUs. Okay, so now, today, what we're really going to focus on is defining LSVT LOUD speech therapy and LSVT LOUD PT or OT therapy, and how these can really help you with the common changes that you might be experiencing to your movement and your voice with Lewy body dementia. You're going to get an opportunity to practice some of the exercises, both with BIG and LOUD, and recognize how they could possibly improve your movement and communication. And then we're also going to talk about how you can access these programs in your community, and also your rights to accessing therapy services with Lewy body dementia. So before we get started, I'd like to find out who's with us today. So Rose is going to launch a polling question here so we can see who's in our audience. Usually takes just a second. All right, so you'll notice we're asking there if you're a person with Lewy body dementia, and that could be Parkinson's disease dementia or dementia with Lewy bodies. Are you a care partner for somebody with Lewy? Are you a friend or family member? Are you a healthcare provider? That could be allied health or a medical provider, social worker. Are you a researcher potentially or other? All right, we'll give it a second here. Oh, thank you all for responding so quickly. Looks like it's a nice mix a little bit here. So I'm just going to end the poll now, or I'll give it a second. There we go. I'll share results here. So it looks like we've got 29% are people with Lewy. Excellent. Thank you so much for joining us. 28% we have healthcare providers. And I think this is the first time I've ever seen a webinar not have care partners as the most attended, which we love having you guys too, but it's really nice to see such a mix. All right, with that, I'm going to stop sharing. And I am going to hand over the presentation to our first presenter, Heather Hodges. Welcome, Heather.
Thank you so much. Thank you for having me today. It's truly a pleasure to be presenting, and I agree. I'm so happy with the big mix of folks who are attending. And so with that, I will go ahead and start. As Julia mentioned, I am a speech language pathologist. The first thing I want to do, though, is just orient the audience to these LSVT programs. So specifically looking at LSVT BIG, which is the physical and occupational therapy, and the LSVT LOUD treatment, which really focuses on voice and speech. They have a lot of similarities. They are based in a lot of the same science that has to do with exercise, intensity, neuroplasticity potential. And so generally, I'd like to share that these are exercise programs. Sometimes I know it's funny to think about voice and speech as something you can exercise, but you truly can, just as you can exercise your body. And with these being exercise-based therapy programs, they are standardized, which is very helpful. One, it's helpful for some of the research I'm going to share a little later, talking about the efficacy or effectiveness of these treatments. They are also practiced with high effort. And so it truly is a really that great kind of workout feeling that you have after you have had a good workout. These treatments, the body treatment, the voice treatment, really do meet that mark. Both programs are delivered by certified clinicians. So these are physical therapists, occupational therapists, speech therapists who've gone through specific additional training to their graduate program work. They have been certified in these specialized treatments and are able to provide these therapies to patients. There is a prescribed dosage and method of delivery for both. Both are offered for 4 days a week for 4 weeks, so it is intensive in the amount of days that you are meeting with your therapists. This is research-based. It truly is a prescribed research-backed dosage. So those 16 treatment sessions within 1 month, we will present on the lasting impacts of that just 1 month commitment from folks. And they are delivered one-on-one for 60 minutes each session. So you get individualized, personalized treatment from your therapists. And what's unique about these programs is we know that Lewy body dementia makes movements slower, make movement smaller, and the voice gets softer. LSVT counteracts this by training bigger movement, louder voice, The feeling that patients get is that they're maybe moving too big or they're speaking too loudly, when in fact, what these therapies are doing is just resuming voice and movement to normal amplitude, so that you get a healthy voice, you get healthy, normal movement, even if the sensation your body is telling you that it's too big or too loud. And what we very much recognize is a necessity with these treatments is that, yes, we are addressing the motor system, we're addressing muscles, we're addressing range of movement, but it is just as important that we are addressing non-motor symptoms that are common to Parkinson's disease and to Lewy body dementia. One part of the non-motor symptoms that we are addressing is the sensory component, the feeling that you're moving too big or the feeling that you're being too loud, when in fact your movement and voice are normal. And as I mentioned, these are individualized, they're one-on-one treatment sessions. And what's really nice about that is we can work on what's meaningful to each patient. While the dosage and some of the exercises are a standardized protocol, the treatment is anything but routine and drill. It's actually going to be personalized for each individual patient, and that's so very important that we're addressing your specific needs and goals. And what's also unique is there's over 30 years of scientific research on the application of this treatment to individuals with Parkinson's and with other neurological disorders. So it is standardized, yet individualized. We're going to work with you, perhaps with your family, with your care partners, to really customize the treatment. Work on the goals that you have in mind for your body movement and for your voice and speech. We can also have this be adapted and progress to meet each individual person's needs. And what that means is we're really able to work with patients across severity levels, from folks who are more mildly impacted, maybe they're earlier diagnosed, to those who are more severe in their disease process or perhaps have been living with Parkinson's or LBD for longer amounts of time. And so we can really work on we meet you where you're at when you come into your assessment with us. There's 3 key features to LSVT LOUD and LSVT BIG. And this is where a lot of the research to formulate something standardized, research-based, and with a specific protocol. The first thing is target. In treatment, we're targeting bigness or loudness, and this is referred to as amplitude, how much you are moving, how big or how loud you are moving. We also recognize that mode is important. We're going to keep you in a high effort, highly engaged treatment throughout your 16 sessions with us. As I mentioned, it's intensive not only because it's 4 days a week for 4 weeks, but also within the treatment sessions. You're going to be engaged, you're going to get a workout, you're going to reap the benefits that happen to our body, our voice, as well as neuroplasticity, perhaps making brain changes during these treatment protocols. And calibration. Calibration is what we refer to when we're working on resetting your sensory system. The sensory system that's telling you that your smaller movements, your softer voice are actually normal, when in fact, those are movements that are not safe. They perhaps can be limiting you in your activity level, and your voice and speech cannot be heard, which leads to frustration. And so it really is the recalibration of how these movements feel and recalibrating so that what is actually normal voice, normal movement, you feel comfortable with so that you have lasting success. And so, for example, when we think about the voice and speech, on the left, what we see coming in this drawing is this voice and this system that's too soft, the movements are too small, and with a single target, we say think loud, it actually activates bigger breath, we get more movement from the vocal tract, we get more engagement, better articulation. So if you're wondering about changes to your articulation being addressed, yes, we are changing behavior across the speech system, but we're focusing on loud. And same with the movement. On the left, you see the person with the smaller movement. Perhaps they have an aid like a cane, and we're going to be retraining healthy amplitude, healthy movement through the one cue of big, thinking big. So that way, when you walk out of your speech and body therapies, you're going to have this nice, strong voice. You're also going to have these nice, strong movements within your body. And you'll notice that the person on the right who's walking, posture is better, steps are larger, and no assistive device is required. And these are real life changes that we really truly do see and that the research backs. We get asked a lot about the intensive mode, and like I mentioned, it truly is backed by research. And so the 4 days a week for 4 weeks, this is a minimum dosage for efficacy. Some people require a few more treatment sessions beyond that. This will be determined by you and the treating therapist, and they'll be there along that 4-week journey to determine who needs more intervention, if there's something that they need to target a little bit harder or whatnot after those 16 sessions. They're going to individualize it for you. All of the treatment sessions are individual, not group therapy. And you also get homework, because if you're only practicing during your treatment sessions with your clinician, you're not going to be reaping the long-term benefits of truly carrying over these healthy ways of movement and talking into your real life. So there is daily homework and carryover activities. That'll be part of the intensity. And it is certified clinicians that will be providing you with these treatments. Our goal is that you don't just improve in our treatment room, but instead you graduate from your treatment protocol, and now you have these new habits, and you get into this lifelong habit of practice. And through the protocol, the routine, people get very, they pick up on the routines of practice. There's also ways to help the care partners encourage their family member to engage and make that exercise a true habit for them, so that you have a voice and you have body movements that are healthy and lasting. And that's the goal with the calibration, that when you leave the treatment room on any given day of therapy, and certainly after you graduate from your month of treatment, that the individuals are using bigger movements, louder voice automatically in your daily living, and you're able to maintain the bigger movements and loud voice over time. Why do we see that these protocols work so well for people with cognitive impairments? And these are some of the reasons. The techniques and the targets of thinking loud or thinking big have a simplicity to them, and they have a repetition of cueing that you're able to learn, you're able to get into those routines. The sheer repetition of practice that we offer will help with maintaining and creating those routines. It is individual, so it doesn't feel like you're getting drill and it's just following a protocol to a T. It's something that we individualize to our patients, so it's meaningful. And it's much easier to learn a routine that's meaningful than one that would just be rote or boring for the individual. These exercises are designed to directly improve function. So there's no wasted time or wasted minutes on exercises that don't carry over into your real life. The intensity certainly helps with making these routines occur. You're going to have fun too. You're going to be motivated and empowered by your therapist. And we're going to help identify with the patient, the family, and the care network on tasks that are meaningful and salient. And it's also easy for the partners to learn if needed, if they are required to help with cueing for the person who's been diagnosed with Parkinson's or with Lewy body dementia. And so specifically looking at LSVT LOUD, I want to share with you a video of a woman. You'll see her pre-treatment in the first half of the clip, and then you'll see her post LSVT LOUD treatment. And in her interview, she'll talk about some of the meaningful changes that have occurred as a result of her treatment.
Have you noticed any changes in your speech or your voice that you would associate with Parkinson's?
Yes, I don't speak loud enough a lot of times.
Anything else?
Hoarse.
Anything else?
I stutter, which I never did before.
Do this for me if you would. Take a deep breath and say ah for as long as you can.
Ah.
Good for you. Okay. Would you say Parkinson's disease has caused you to talk less?
Yes,
Because?
because I stutter and then I can't be heard. If there's noise in the house, like when the kids come over, nobody pays attention to it because they can't hear me. Till I get mad and then yell.
Take a deep breath and say ah for as long as you can. Have you noticed changes in your speech or your voice as a result of the speech therapy?
Oh, yes.
What have you noticed?
I talk louder. I think louder. I'm going to sing with the Sons of Pioneers one of these days with my voice.
Good for you. That's excellent. What practicing do you do at home?
My ahs, my highs, and my lows. And I read out the mail out loud.
Excellent. Do you feel like practicing helps?
Oh, yes.
Okay. Do you feel as though people can understand you all of the time now?
Majority of the time, unless it's my husband, and he'll say, "What? I can't hear y'all."
Good for you.
But I think he does that just to be cute.
I think he does too. Has anyone commented that it's easier to understand you now?
Oh, yes, I set some of our friends back when we went to their house and I talked loud. Lou says, "What the hell happened to you?" My daughter said, "Oh, Ma, that's you?"
Isn't that good? Don't you feel wonderful?
Oh, yeah, because now she can't say, "I didn't understand what you said."
Right? No excuses, right?
Yeah,
That's
no
right.
excuses.
All right. So what do you do when you want to be as easy to understand as possible?
Think loud.
I love that video. It always gives me, I call them the good goosebumps, because it truly is so heartening to see those very characteristics in her pre-treatment of the hoarse voice, the quiet voice, monotone voice. She's mumbly. It's harder to hear her. And you can tell she's just frustrated, and it's affected her mentally and emotionally. Post-treatment, after just the 4 weeks, her recording shows this, more expressive. You can understand and hear her. There's no hoarse or voice quality. Her articulation's improved. But what really gets our hearts is her impact that it's had on her life and her confidence, her socialization, all the things that really speak to our hearts. And so this is a brief overview of what a treatment session would look like. It's guided through from your speech clinician that would be working with you. You can see that there's a lot that is put into a day. So you can bet it's never boring. It's getting that good workout feel, maybe a feeling that you haven't really tapped into in a long time. And it is going to include assigning homework, carryover activity, etc., all while we're addressing your interests, your individual needs, and tailoring that treatment so that it's truly salient and meaningful to you. We talked about the calibration component, where when people are asked to speak loud, and like in that video, her name is Shirley, you could hear that she wasn't too loud. She wasn't yelling at us. In her sensory system, she felt like the person on the left. She felt like she was screaming at people. But through therapy, what we are aiming is that people get comfortable with this new way of speaking, and then they recognize they're actually more like the person on the right, where she's speaking normally, she can be easily understood, and it starts to feel more normal. This is some data showing that there's a long-term impact of this month of therapy. We compared LSVT LOUD, it's in the blue line on the graph, to traditional therapy at the time, which focused a lot on respiratory and breath support. And we looked at folks over a 2-year time span, and we found that those individuals who had LSVT LOUD maintained increased loudness to a significant level for up to 2 years out. We've actually worked on improving the therapy so that we see even better gains maintaining longer. I can say clinically, I have one patient right now that I see in Loud for Life group, and she had her initial treatment 10 years ago. We just figured this out, and she hasn't had need to come back and have intensive therapy with me again because she's continued her habit of practice, her exercises. So while this shows 2 years of improvement and a long-lasting impact for just a month of your time, we see clinically that those gains can last even a lot longer. And so LSVT LOUD is going to improve the overall bigness, that amplitude that you need to have your speech system moving for easy to hear and understood speech. Initiation of voice. You may find sometimes it's hard to initiate or start your voicing, or perhaps you get tired when you've been speaking for a long time. So endurance improves. Breath support for speaking, your clarity. We saw facial expression improve in that video, and we do see that, and it's been researched within our patient population. Intonation, no more monotone voice, and that confidence. So I'd like to do a couple of exercises with you to get you a little taste of treatment, and also to help engage as you're watching. We want to make this nice and interactive. So let's practice. The first thing we're going to do is that long ah that we saw in the video. This is one of the stepping stone exercises for our individuals. And so it's going to look like this. I'm just thinking loud. Ah. Let's do that together, and we're gonna hold it for 10 seconds, all right? If you feel a strain, that should never hurt. We never want the voice to hurt, so just a nice, healthy loudness. And if you can't hold it for the full 10 seconds, no worries, just catch your breath and join back in. All right, 1, 2, 3. Just like that. All right, grab a drink if you need to. We'll do one more. 1, 2, 3. Ah. So that's a nice little taste of a workout for you. We also use that nice loud voice for functional phrases. Usually it's 10 functional phrases, but for this demo, we're just going to do 4. Nice loud voice, just like you gave me for your ah. So I have 4 listed here, taken from a patient who said these are really phrases they say every day and are meaningful to them. All right, number 1, how are you? 2, I love you. 3, what's for dinner? And 4, time for bed. And so this is an example of taking that ah loudness right into your daily voice, things you would say every day to your friends, family member, or community. So I hope that was a nice little taste and snippet. I'd like to now hand it over to my colleague, Jenny Tuccitto, who will talk to you more about the LSVT BIG protocol.
Hi, everyone. Thanks for joining us today. My name is Jenny Tuccitto, and as I was introduced in the beginning, I'm the physical therapist in the bunch here who has been delivering LSVT BIG since 2009, which seems a long time ago now. But I'm here to talk to you about the LSVT BIG side of things, and as well, I'll take you all the way through the wrap up and the conclusion here. So we're going to start just like Heather started with looking at a little bit of a video of some pre and post LSVT BIG treatment, so you can get a chance to see what that looks like. And let me see if my slide advancing is working. Yes, it is. Okay. So this video has no sound in it. So all you're going to see is the movement, and it'll be pretty obvious, but you're going to see a split screen where one side is pre-treatment, the other side is post 4 weeks of LSVT BIG treatment. So while we watch together, I will talk you through a little bit of it. So this gentleman's name is Bernie. He was 71 when he was diagnosed, and for him, it was true idiopathic Parkinson's disease. He had had Parkinson's for 14 years when these videos were taken. So on the left-hand side, you can see he's got a cane. He's experiencing a lot more shuffling and freezing of gait as he's approached those rugs and the flooring, and is really struggling to just kind of get himself out into the parking lot. Whereas on the other side of your screen, after 4 weeks, he's already out in the parking lot. He's cruising around. His step length is longer. His arms are swinging better. Notice his wife is nowhere to be seen. So definitely more confident with his walking ability. And in fact, he walks past his car and continues to turn around and keep on walking. So these are what we consider to be normal outcomes of using LSVT BIG to address gait, address that shuffling of gait, and all of those things that happen with walking as a result of Parkinson's and atypical versions of Parkinson's disease, which is where Lewy body dementia falls into the mix. So they're all in that same family. And I would say with my clients who have Lewy body dementia, that I definitely see very similar results with improving those the ability to walk, the stride length, and all of those things with their walking. So how do we achieve that? Well, this is what a typical session would look like with your therapist who's certified in LSVT BIG. So like Heather mentioned, for the voice exercises, there's a series of exercises people practice. For movement, we have more. We have 7 exercises compared to their 3, but it's really because the body moves in a lot of different directions, way beyond what you traditionally might think. We move forward, we move sideways, we move backwards, we move in diagonals, up and down. We have all different kinds of directions our bodies move in. So we designed these exercises to really be able to encompass all of those different movements. And in a little bit here, we'll practice a couple of these together. But the first two are traditionally done in sitting, floor to ceiling and side to side. The next 5 are traditionally done in standing. However, each one of these exercises can be adapted to fit your ability level. So if you are someone that is not very confident in standing because of balance concerns, a history of falls, things like that, we can adapt these to have you hold on to something on one side. We can even adapt them to be done from sitting or lying down. So really meeting you where you're at, where your ability is at the moment in time where we start therapy. And then as abilities improve or change, we can progress up to standing or progress up to different ability levels. In addition to that, we are always going to practice walking big, like you saw in that pre and post video. And we're going to practice some what we call functional component tasks, which are similar to those phrases that Heather just practiced with you, where we pick some everyday tasks that you always do, and we practice those. So it might be standing up out of a chair, might be pulling, grabbing your cell phone to use your cell phone. It could be twisting to open a water bottle, or brushing, the brushing motion of brushing your teeth. It really could be anything you come up with. I've been asked by women before to improve their ability to put mascara on. So it really is a creative connection between you and your therapist to talk about, hey, these are things that are a little hard for me, or maybe your care partner is giving some feedback on, hey, my husband really struggles with these things, and these are things that I'm having to help with. So how can I help him better? How can he learn to do it better? And working together to define what those things are. The hierarchy tasks then, or hierarchy exercises, are more complex tasks, which means they have a lot more steps to them. Think of it as like the difference between simply brushing side to side, brushing your teeth, or the entire process of brushing your teeth, which means you have to get to the sink, you have to open your toothpaste, you have to get your toothbrush out, you have to brush, you have to rinse, you have to put everything away. So thinking about that as a more complex task, or something like getting out of bed, needing to take a shower, something that has a lot more pieces to it. So we practice those more complex functional tasks as well. And then every person has homework. So everyone is asked to do those same exercises that they did in treatment with their therapist at home, as well as practice those functional activities that we were working on too. We assign homework all 30 days of the month that you're working with us. And then there is an expectation that you're going to continue to do those exercises daily on your own for the rest of your life, practicing to keep up that effort. So when we were talking about those exercises, here's what those 7 exercises generally look like. You can see the first 2 are done in sitting. The next 7 are done in standing. You can see in standing, there's a forward, sideways, backwards motion. And then we also do these rock and reach exercises, which is more of a fluid motion of going from front to back or side to side. When we get to that functional task completion, like we said before, they are personalized to you. So it can really be anything that you can think of that you're struggling with. So if you are going to pursue seeing a therapist, really be open with them, share with them. Hiding the deficits does nothing to help you. And sometimes that means asking a caregiver for feedback too. So I always, ask permission. Can I ask your husband or ask your wife or your daughter what they notice? And if you're the person living with the diagnosis, try not to be angry with them for giving their feedback. Really be thankful that they're giving you that feedback, because if you don't know that there is a problem with it, it's hard to try to fix it. So in working with the client who's living with this diagnosis, as well as family and friends that might be involved in your life, we can really come up with our goals for what functional tasks are most important, what should we be working on and focusing on in our sessions. And then our overall goal, like Heather said with voice, is very similar, where we want your bigger movements to start to feel more normal again. So in Parkinson's or any of the atypical Parkinson's like Lewy body dementia, we know that there's a mismatch between someone's perception of their movement and how others perceive it. So if your wife keeps telling you, you need to take bigger steps, but the steps you're taking already feel big to you, they feel normal to you, it's hard to then trust them to know that, okay, I actually do need to take bigger steps. So how do you realize that your movements need to be bigger? And then how do you work on making them bigger and allowing that to start to feel more normal? My goal is not that you're going to always walk around in the world feeling like you're walking too big, like people are going to look at you crazy because you're walking like this. I want you to eventually go back to the feeling of, hey, this actually feels pretty good. This feels pretty normal again. But it does take trust with your therapist in that fact that, hey, you got to trust me here. This actually looks better. This looks more normal, and let's keep practicing. It's the reason why there's so much repetition built into this treatment program, is to get you to eventually become more comfortable with those bigger movements. We may choose to use a little video feedback to even show you. I feel like a picture's worth 1,000 words, right? So if you can see yourself on video, sometimes that really helps as well. Then just a little bit on the research and background in LSVT BIG. This is one of my favorite studies, and it was published back in 2010. Dr. George Ebersbach, who is a movement disorders neurologist just outside of Berlin, Germany, was really a pioneer in taking in this new treatment at the time, this brand new treatment of LSVT BIG, sending his clinicians to the United States to get trained in it, and started doing some randomized controlled trials of researching it to see, how does this treatment compare to other treatments that we had tended to use for Parkinson's disease? So they actually took 70 different clients. They divided them into 3 different groups. 20 of them did LSVT BIG treatment, like we just talked about. 20 of them did Nordic walking, which is walking with those Nordic poles, which some of you might be familiar with. And 20 of them did more of a traditional, just meet with your therapist, do some home exercises, things like that. So out of those 3 different exercise groups, we saw some different responses. So if you're looking at this on your screen right now, what I'm going to do is just orient you to it. So we're going to focus on the graph. It starts at 0 weeks, meaning very first meeting with you. You can see week 4, there's a line there. So that's where treatment ended. And then it goes out to all the way out to 16 weeks. So 4 months, basically, from the time those patients started till they were done. We followed them for 4 months. What they did was look at what their response was on the UPDRS scale, which you may or may not be familiar with. Likely that your movement disorders neurologist or neurologist does the testing with you and you just don't know it. It's all those things where they have you flip your hands, open, close, all those different things that they might have you do in a regular neurology appointment that feed into this scale. What is better is a lower score. So the lower your score is, the better the test outcomes are. So the solid black line that you see is those clients that just did home exercise. The tiny little round dots that you see are the people that did Nordic walking. And the longer dashes at the bottom are the people that did LSVT BIG. So if you look at the graph, hopefully by explaining that to you, it makes some sense that really the only group that got better and even continued to get better after treatment was done was the group that did LSVT BIG. And when I had a chance to meet Dr. Ebersbach some years after this, when I was in Germany, to him as a neurologist, the most impressive thing about this study was that it created more than a 5-point drop in score on the UPDRS, which is really what they use to advance medications forward in the world of Parkinson's and movement disorders. So exercise alone caused a 5-point drop here, which is really impressive, really gives that idea that exercise is medicine, that exercise is powerful. So what all can we expect some improvements with through LSVT BIG? Well, we're hoping to see that improved amplitude and size of movement and speed of movement. And now I'm always careful about speed because people can move too fast and too small, right? If anyone has seen that happen where the steps get going really fast, so they're moving fast, but they're really small. And sometimes that's where falls can happen. So our goal instead is more size of movement. Speed will come along naturally with that, but I'm more concerned about that size. We want people to be able to start and stop, change directions, improved endurance, balance, better posture, better ability to perform your activities of daily living, and improved walking ability. So one slide, I'm just going to take you through, I'm going to stop right here just for a moment, and I'm going to take you through just a little bit of a demo of what a couple of the exercises look like. So I need to back up here, and as long as you guys can see me okay, we can leave it this way, or Rose and Julia, if you think it's better to stop sharing slides, we can do that as well. But I'm going to invite you to practice along with me a couple of these exercises. So I'm actually thinking maybe it's a good idea for us to stop sharing. If Heather or one of you guys want to do that for me. I think I'm really tiny on the screen otherwise. So if you want to practice along with me, you are welcome to. If you don't want to and you just want to observe, totally fine too. So everyone's going to be sitting in their chair. You're going to start with some big effort. So we're going to do legs out, nice and big and wide. So I want you really sitting and taking up as much space as you possibly can. I want you to think about sitting up really big and tall with your posture. So I don't want any lazy posture. Think about that head up, chest out, shoulders back kind of posture. And then just watch me for the first time, and then we'll try one together. So we're going to do a big forward reach. So hands are out big. I'm going to pull my sleeves up a second here. And then we're going to go down to the floor, or as close as we can get, up to the ceiling, like you're raising your hands up high, and then out to the side. And here we're going to hold our hands out to the side, big fingers open, and hold for a count of 10, and then finish here. So I'm going to give you all a chance to just try one of those with me. So anyone who wants to try it, you're welcome to. We're going to do a big forward reach, and we're going to go down big. We are going to go up big, reach for the ceiling. We're going to go out big and then stretch those elbows as long as you can. Imagine someone is pulling your hands from both sides. We're going to use that nice loud voice, and we're going to count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and we are going to finish big. Perfect. So that's an idea of just one of the seated exercises. I'm also going to take a moment to show you one of the exercises that's typically done in standing, but we're going to practice in sitting. So this is called a step forward and reach. So you can bring your legs in a little bit, more to about hip or shoulder width distance apart. And I want you to just watch me on this one. We're going to start here. We're going to do a big step forward, arms out to the side, and a big step back and finish here. So everyone who wants to try it with me, take a chance and let's try that together. Let's do 2 of them. We're going to do big step out, big step back. Nice. Try it again. Out big and back big. Good. And let's try 2 more on the other side, just because I can't leave you uneven. Here we go. Out big and back big. Let's try one more. Out big and back. Nice. So notice I'm slapping my hands. I'm stomping my feet. That's how we're bringing that amplitude into the practice, bringing that nice big effort in. One more thing I'm going to show you, and again, I'll just do this more as a demo, no need to practice along with me, but practicing with a functional task such as standing up out of a chair. A lot of times the problem is people just don't lean forward enough to get that body momentum of getting up. So here's how we typically treat or teach sit to stand, is we do a big reach forward with hands and then up big to stand big. And then it's a big reach forward to slow down that sit on the way down. Okay, so that is kind of an example of one of those functional tasks that we might practice. We gear all the other ones towards things that you need to work on and improve on. And if Heather can share those slides again, we will go back to finishing up talking about the rest. Okay. So just to kind of summarize the treatment sessions then, is we're going to talk about both treatments now and just some summarizing things about it. It means you see, I have to get my controls to function here. The very first slide, when it comes up here, is going to be that idea. There we go. Yay. Is that idea that I shared with you after I shared that study, that exercise truly is medicine. So think about your daily dose of exercise like you think about your daily dose of medication. Research out there to this day has not been successful in finding treatments that can stop the progression of these terrible diagnoses, but research has shown a lot of promising results of the impact of exercise. So if I can just really encourage you, I have worked with clients in my 20-some years as a therapist with Lewy body dementia, where even though maybe the cognitive issues are worsening, some of those things are changing, functionally, they're doing great. You know, they're still able to get out and do the things and walk and do amazing things with their bodies because they've really been adhering to that exercise piece. So, you know, I always try to tell people that don't go down without a fight with any of this. Exercise is really something you can use to give you some power towards that diagnosis. So making sure you're using that. Also, you know, how is the framework of LSVT a good fit for cognitive impairments? Heather introduced this a little bit when we started, but now that you've seen the treatments, think about the simplicity of the focus. We focus on one simple cue of think big or think loud. So if there are memory impairments there are cognitive impairments there, this treatment program is built to work well for that. We do things very repetitively and we focus on one simple cue. We also, your therapist, if you're a person living with LBD, your therapist is going to do the exercises with you. So if understanding verbal directions sometimes gets a little hazy or difficult, but watching someone do something is easier, this treatment is also built for that. The therapist will do it, you do it with them. It's a much easier to learn. The exercises and the high repetition are there on purpose, and that meaningful skills activity, right? Learning what words and what phrases do you say on a regular basis or do you need to say? What movements do you do or you need to do? And really focusing on you as a unique individual. And our goal in LSVT LOUD or LSVT BIG is to always enhance and motivate the person living with the diagnosis. My first focus is always you, if you're the one with the diagnosis. However, we have a lot of great tools and things available to help caregivers also be a part of that conversation. So what are some things about LSVT that care partners should know? If your loved one, a family member, friend is going to go through LSVT treatment, you know, how can you support and what can you do? We know through LSVT treatment and research that the earlier we can address this, the better. So when you go into those medical appointments, they can be very overwhelming. Write down things you want to ask for, write down questions you have. And if you can, bring a family or friend with, establish that, you know, if your doctor doesn't just offer up the idea of referral to physical, occupational, or speech therapy, ask about it. It's your right as a person to say, I want to go to therapy. Can you write the order for me? And if LSVT BIG or LSVT LOUD is the treatment you want to pursue, say that too. Like, this is the treatment I want to do, and I want a referral for that. People with Lewy body dementia can improve their function and not just compensate for their deficits. One of my old clients just still keeps coming to my mind. You know, he was in up until his death, coming to our classes in our facility, walking in and out of our building without an assistive device, and, you know, functionally moving well, even though cognitively things had changed a lot for him. So he just was walking proof to me that people can get better. There are things you can improve as you go through life with this diagnosis. General exercise, just going to the gym and doing general exercise does not replace the need for therapy. I really believe strongly in this, that one-on-one interaction and feedback that you get from a therapist that is tailored for you specifically is so important. They can help guide you on what types of exercises might be beneficial for you when you go to the gym, but use them as that resource. And how do you reinforce if someone is in therapy? Anytime you need better movement or better volume of voice, that idea of think big and think loud. Discuss with the therapist what else you can do. Go to those therapy sessions too, if you're invited to, and observe. And we also have some homework helper videos and other resources to help. We really want you to think about therapy as a lifelong model of care, that you're going to initially go in for those 16 treatment sessions of LSVT LOUD and or LSVT BIG. You're going to be asked to do your daily practice. We even have group exercise practice opportunities too. They're called Loud for Life or Big for Life classes you could participate in after your therapy is done. And then schedule those tune-ups. With something like Lewy Body Dementia, I'd say every 3 to 12 months, you should probably be touching base with just like you touch base with your doctor. Go in and be reassessed. Have things changed since the last time I was here? Is my volume of my voice softer? Are my movements smaller? And what can we do to treat that? We rarely repeat the entire 16 sessions over again. It's usually just a shorter dosage, a shorter tune-up to achieve your goals. And I know I had seen in the chat that some people were asking about, does Medicare cover this? Is there insurance coverage? Yes. So LSVT BIG is not its own insurance thing that you have to ask about coverage for. What you want to look for coverage for, and same for LSVT LOUD. LSVT BIG is delivered by physical and occupational therapists. So if you want to check your policy, look at what your coverage is for physical and occupational therapy. Same for speech therapy. Speech therapy or LSVT LOUD is delivered by speech therapists. So if you want to know what your coverage might be for LSVT LOUD, check with what your coverage is for speech language therapy pathology. And percentages will vary. Medicare, straight Medicare typically covers about 80% of therapy costs. And if you have a secondary insurance, that will pick up some or all of the other portion. If you have a Medicare managed plan, that might be different. So most Medicare age plans, whether you're on a managed plan or a traditional Medicare plan, focus on medical necessity to determine your coverage. So if you go in for assessment, your therapist determines that therapy is needed and this is what's needed. That's all they have to do in their evaluation, basically, to say this is the therapy that's needed. Some coverage plans may require a prior authorization, which your therapist would help with and take part in submitting all of that. We also have a lot of tools to support that home practice. So especially if there are memory or cognitive issues that are going on, sometimes like just the ability to be reminded that you need to exercise at home is helpful. Sometimes it takes a little bit more. We have homework helper videos for both LSVT LOUD and LSVT BIG that can be purchased through our store. There can be the true DVDs, or you can download a streaming option of it as well. If you're working with a therapist that uses Physiotech as their exercise prescription system, our LSVT BIG exercises are on there. If you're doing the LSVT LOUD speech therapy, we have something called the LSVT Coach. And there's a client edition to that. So you can use that LSVT Coach at home to help guide you in your practice at home, which is a wonderful tool. We have Big for Life and Loud for Life online classes, which are through that LSVT for Life practice. We have an online option we offer through LSVT Global, but there also are a lot of community-based exercise options for classes like that in your communities too. If you are interested in learning more about LSVT LOUD and LSVT BIG, we have so much information on our website. So much that sometimes it's even a little hard to find. So this can be just a little guide for you on where to find that. Our front-facing website, which is listed there, has a ton of information about our treatments. But on the back side and our blog, so if you click on the little button at top that says blog, you will find way more than just a blog inside of there. You're going to find a variety of on-demand and live free webinars that we do for the community. You're going to find different articles, testimonials, videos, and all of the research, as well as some FAQs. And we are on all the social media platforms: Facebook, Instagram, Twitter, LinkedIn. You can find a ton of information on those as well, and we like to post to those frequently and often. I also saw people asking about, how do you get started with treatment? We have a wonderful tool, a search tool on our website, and you can see a picture of it there. The red or orangish colored Find LSVT Clinicians is how you can find if there's a clinician in your area. So, you can ask that doctor for a referral. The referral, if it just says physical and/or occupational therapy, and key would be evaluation and treatment if you're looking for LSVT BIG. And then for speech therapy, for LOUD, it would be speech therapy, evaluation and treatment. And if they can specifically write LSVT LOUD on it, you can take that referral or that order for therapy to your physician and then use this Find a Clinician search tool on our website to find clinicians that are in your area. Little tip from me is, I do feel like the easiest way to search is to put in your zip code and then put in the radius in which you're willing to travel, and then it will feed you back a whole bunch of clinicians in your area. If you are struggling and it's difficult for you to use that tool, you can also always reach out to us by emailing or calling our office and asking for some support in doing that search. And our team, we have a wonderful team, they'd be happy to help you look for clinicians in your area. So at this point, I'm going to flip it back over to Julia, who I know has been busy monitoring questions throughout the whole presentation here. And Julia is going to ask us some that she didn't ask, or maybe that would be important to repeat again. And I know some questions were sent in even ahead of time that we want to make sure to address. So if anything if we don't answer something here, or you think about it later, you can always at any time email us at info@lsvtglobal.com, and we would be happy to answer that. You can also email Julia at the Lewy Body Dementia Association, and she would be happy to answer questions or forward them on to us as well. So over to you, Julia.
Excellent. Thank you guys so much. That was wonderful, Heather and Jenny. Great job. All right, so let's take some questions. And our recent webinar, you guys, our first one of the year was on purpose. And so this first question I love so much. So someone asked, how can I add meaning and value to my loved one's life with these ideas? So who wants to go first? Because I think both do. Go ahead.
I can start. And if Heather has anything to add, she can add it after that. But hopefully I covered that a little bit in just that idea that exercise is medicine. Don't just take this lying down. Exercise is good for cognition. It's good for body. It's good for movement. It's good for voice. It's good for everything. And I think when you're given a diagnosis that looks so gloomy, like I had a client tell me this at one point in time, that I sat in my doctor's office and they told me all these things, and you kind of almost black out in what they're telling you. And then you go home and you get online and you start researching, all these things about it, that he felt like his light was being dimmed. And after he got done with our 4 weeks of LSVT BIG therapy, he said to me, "Thank you for turning my light back on." And so I think that idea that, grabbing the bull by the horns, that I'm not just going to take this, I'm going to do something, can give you a lot of meaning, that something that takes power away from you, find ways to put power back in. And so I think that would be my piece of advice.
Absolutely. Anything you want to add, Heather?
I totally agree. I think empowerment is so huge. And often what we see when people start to have difficulties with voice, speech, or movement, they start to withdraw and they start to no longer initiate conversations or initiate movement, getting out of the house, etc. And then I want you to keep in mind that if you stop using it, you lose it. And so being proactive, getting that empowerment to you, to your loved ones, getting them to therapy sooner versus later is so very important, so that you don't have to fight that withdrawal, the social isolation that often occurs. And so I think it echoes what Jenny says, but just another thing to keep in mind: you can't get to treatment sooner, soon enough. Even if you're having mild changes or you're noticing mild withdrawal from your activities and your communication, it's beyond time to start intervening.
Absolutely. And I would just add to that, to you guys, the functional component tasks that are so unique to this program, where you get to select things that are meaningful and relevant, because we hear so much, and have questions a lot about how to get people more engaged, how to really, kind of get someone to initiate with Lewy. And a lot of times it's finding something that really they're passionate about and that they enjoy, that they can do again. So that's what those functional components and hierarchies really address. All right. Let's go to this one. So we've gotten a lot of questions here about kind of, Jenny, that shuffling walk, that dragging the feet. Does LSVT BIG help that?
Well, I hope I convinced you that it does. But if you still need a little more convincing on that, yes, absolutely. What's happening, because of the brain changes, is you're starting to feel like these small movements are normal, and they're in fact not normal. So working one-on-one with a therapist who can help guide you to get those bigger steps, to stop sliding your feet. We talk about that scuffing noise. Like, I don't want to hear any scuffing. And I like to have a lot of fun with it and be like, I can hear you, I shouldn't be hearing you, and really work on that longer stride length, that less slide of your feet. I hope that video even helped with that a little bit too, that you saw how much Bernie changed with his walking. So yes, absolutely. I think there was another early question too about weakness. A lot of times weakness is more an effect of just lack of activity than it is the diagnosis itself. So, making that exercise piece alone will help with that. But many people think that I'm walking with these shuffling steps because my legs are weak. It's not necessarily your legs are weak. It's that your brain communicating with your legs is not asking for the right amount of output, that your legs are able to do more output when they are cued to do so. So it's not always necessarily weakness, and your therapist will help work through that with you.
Absolutely. And the sit to stand that Jenny demonstrated when she talked about how people don't lean forward, a lot of times that's where people will, oh, my legs are so weak, I can't even get out of the chair. And it's not actually the weakness, it's just that movement planning. This next one is for you, Heather. And so we're getting a lot of questions about kind of the relationship between addressing the speech changes and how that impacts swallowing. So can you speak a little bit to the overlap of those two and how this helps swallowing as well?
Yes, absolutely. That's such an important thing, because we know that the speech system and the swallowing mechanism have a lot of overlap in the muscles and structures that are used. We also know that swallowing disorders can be very prevalent in these diagnoses. And we know that if someone aspirates, it really can be something that is life-threatening and lead to pneumonia, etc. So it's really important to know that swallowing evaluation, if you are having any signs or symptoms of choking or wet voice or feeling residue or clearing your throat after a swallow, those are important signs that you likely need to get a swallow evaluation. It has been really interesting that this intensive exercise with LSVT LOUD clinically, and a bit of research has shown that there may be some improvement to the swallowing mechanism as a result of LSVT LOUD. It's something we're still investigating though, and I wouldn't say that LSVT LOUD replaces swallowing intervention. We want to be very proactive with addressing any swallow issues or safety concerns we have with swallowing. And so that likely is going to be a separate swallowing therapy program that may or may not coincide with LSVT LOUD as its own standalone therapy. So you may notice some improvements, but it won't be a replacement for true swallowing therapy.
Absolutely. And we've had some questions too, because Jenny, some people want to know, like, can I just do these at home without a therapist and, or just, you know, as an exercise? So give us a little advice on that.
So once you've worked with a therapist, yes, you will be doing them at home, but you really do need that therapist to help guide you to make sure you're doing them correctly with the right amount of effort, right amount of amplitude. So we just told you throughout this presentation that people with diagnoses in the Parkinson's family, such as Lewy body dementia, have decreased sensory awareness. And what that means is that you may not be aware that you're too slow, too soft, too small, all of those things. So the idea that you could give yourself the correct amount of cueing without any guided therapy improvement is not great, right? So having that therapist to establish that baseline, you know, of here's where you need to be, here's the amount of effort you need to do, and then allow you to continue to practice on your own is really important. So use the professionals that are there for you, as well as this is so much more than just an exercise program. The exercises are a small part of your hour-long session with your therapist. I mean, in my sessions, we're done with the exercises in 20 or 25 minutes. We're spending 30 or 35 minutes focused on function. So it's not just an exercise program. There is a lot more to it in order to get those outcomes that we talked about.
Absolutely. Well said. Okay, Heather, this one, you've heard this a few times, few hundred times probably. So this is a care partner who says that she's hard of hearing and her husband with LBD mumbles. So it's part of their frustrating life. And then, you know, so what should I do or say? And some people have asked that about like cueing, like how do I kind of cue or prompt my loved one? And is that part of what you practice with LSVT LOUD too?
You're absolutely right. This is something we hear often where there's a communication breakdown, maybe for a couple of reasons. We also sometimes hear from patients that their spouse needs a hearing aid when in fact the spouse has normal hearing, but it's that sensory component Jenny and I have been speaking to you about where the patient thinks they're speaking fine when in fact they're too quiet. And so, but when there is this sort of double reason for communication breakdowns with spouse has a hearing aid, patient is too quiet, there are things the spouse can do to ensure that they are setting up the communication for success. So please wear your hearing aid. Please have your hearing aid on when you are communicating with the person who has the voice and speech disorder. In therapy, we absolutely work with the family member, with the patient, to come up with ways to cue the patient in a way that won't be embarrassing or frustrating or take away the autonomy or confidence the patient has within their communication. And so often it may just be a simple cue that's agreed upon, such as, you know, hey, honey, can you tell me loudly what you want for dinner? And it's nothing abnormal. It's not having to say, what did you say? Or talk like you do in therapy. You know, those things are not so helpful. And even just a simple strategy of being face to face when you're talking, so that you can have some of those visual cues of facial expression or maybe even lip movement that is helpful. And same thing with really any component that you're noticing a deficit, like you mentioned, swallowing or eating, chewing, just that reminder of, oh, you're eating steak. Let's make sure that we chew it enough, you know, make it a partnership, make it so that they feel they have an equal stake in this as your caregiver. And if you are noticing that the way you're cueing your loved one is frustrating to them, I think it's okay to propose some new strategies. What can I say? What's helpful? Try out some of those cues with them and determine what works best and is not threatening or degrading to them.
Excellent, excellent. I know I have a dear friend with Parkinson's disease dementia, and a lot of times I blame it on myself. If I can't hear him, I'll be like, "Oh, I missed that. It was a little loud in here. Could you say that again for me?" I just
Yeah.
act like, it was on my end. Or sometimes I will, if we're out, I'll give him one of these, and he knows like that's my speak up cue.
That's the cue. Yeah, the little, or just a subtle like finger, put the volume up. Or I do find that idea of putting it on you of, oh, my hearing aid's not picking you up. Can you say that louder?
Absolutely. Sometimes we just have to take one for the team.
Yeah.
There was a really good question here that I wanted to bring up. And so, just like with Parkinson's, if we see someone earlier on, we're getting these questions like, well, if they don't really have that many deficits, how could they do this? What would you work on? So do you guys both want to talk about what we consider kind of prehabilitation a little bit?
Yeah, absolutely. And I think I just answered the question quick in the chat about that actually. Is I always tell people is there's a reason you were diagnosed with this diagnosis. So something was going on, or you wouldn't have pursued trying to figure out what was happening. So even if those changes are small changes will become big issues if they're not addressed. And so the sooner we can address them, the more we can help slow down them becoming bigger issues. So I have patients tell me that all the time, that I can do everything. There's nothing that I can't do. We start talking about, well, maybe what are you a little slower at doing? What is maybe you get a little frustrated with? It doesn't have to be things that you can't do. It's what things have we noticed these little changes with? And then we try to focus on those things, or the question of, what are you fearful of losing the ability to do? And let's address those things now. So, we talked about social isolation. I don't want you to stop going to your weekly poker game with your buddies. What can we do now to try to help with that so that you don't ever feel like you're in that, so you don't feel like you're in that position sooner than you want to be? So that's kind of my piece of advice, and be very open about those minor things with your therapist, because if we don't know about them, we can't help.
Absolutely. Anything you want to add to that, Heather? Last word?
I would just say too, that being able to intervene when something is mild is a lot easier than when something has progressed. And so for the patient and their family to get the biggest result is that's going to last the longest, and to get those routines. These are exercise routines. We make them a habit. Let's make this a routine and a habit, something you're so familiar with in this mild stage, in this early part of your diagnosis. Let's get this so solidly established that it's going to become an easier part of your routine, versus waiting till you're at a moderate stage or more, where you're going to need more assistance from your family, from your caregivers, from outside influences. So let's get in there now and find those things that maybe, like Jenny said, have gotten a little hard for you, or you notice you're shying away from a little bit. Let's get in there before it truly becomes an isolation or an avoidance, where we can be the most proactive and have the biggest impact.
Absolutely. Thank you both so much. That was excellent. So you want to go forward to our thank you slide? I think we're at time here.
Yeah, absolutely.
Great questions, you guys. Excellent. All right. So thank you so much, you all, for your questions, but unfortunately we're out of time. So please use your reaction buttons now to give our presenters a round of applause. It looks like you're already on it. On behalf of the LBDA and our amazing presenters from LSVT Global, Jenny Tuccitto and Heather Hodges, I'd like to thank you all for your time, attention, and engagement. As you log off, please take a moment to complete the brief survey to help inform our content in the future. A reminder, you're going to get that email in about a week with the link for the recording of this presentation, or you can visit our LBDA TV channel on YouTube at any time. Please join us again on Thursday, February 29th at 4 p.m. Eastern Time to learn more about synuclein biomarkers with Dr. Kathleen Poston from Stanford University. All right, on behalf of all of us, thank you so much, and we'll see you again soon. Thanks, Jenny. Thanks, Heather. Thanks, Rose.
Thank you.
Thanks for having us.
Absolutely. Bye, everyone.